Today we are going to discuss 5 most important points which are going to indicate that if you are going through some psychological condition and if you need some psychological help, psychiatric help or help from a mental health professional. So just let's stay in touch here and we are going to get into those 5 points. So let's start with the first sign and symptom, and that is the anxiety. And the anxiety, nervousness, worry, tension, which person used to actually feel in their life, and it is actually distressing their life. So this is the major sign and symptom that anxiety is causing some sort of disruption in the person's life. For example, a lot of people comes towards the sessions and sometimes they just call to get to know that if they are going through some condition which is called anxiety, or if it is the condition which they need help with. So in this condition, what actually happens to the person, that they are in some sort of unnecessary urgency into the minute level of those everyday activities, even like going to the school, like getting ready for work, getting ready for the preparing for upcoming presentation, upcoming lecture, or even they get nervous, they get confused when they are talking to other people, when they are interacting in their social relationships. There is a sort of urgency, there is a sort of nervousness, there is a sort of confusion, they just sometimes get all blank. These are all the signs of anxiety, nervousness, confusion. So yes, you need to book an appointment to get more insight on your condition right now. And let's move on to the second point. Then the second point is about overthinking. Then overthinking is not a problem if it is not interfering with your everyday life, because overthinking is not that thoughts that whatever coming across your mind, because all day long we just keep on going on the cycle of thoughts and they just come and just go and they just pass away. The overthinking we are talking about is when person is overly engaged in similar sort of theme, and when he is thinking about something that is actually affecting his whole body, his emotions, his feelings, his expressions, and everything, and most importantly, his everyday life condition. So this is what overthinking is, and where it needs to be alarming the bells in your ears. The third most important sign is feeling low, down. And in feeling low and down, it is not just sadness, just a plain sadness, but sadness is accompanied by a lot of other symptoms. For example, unable to get up in the morning, unable to do those things, physical activities, exercise, going outside, whatever things you used to enjoy, whatever hobbies you used to enjoy, you are unable to do, and you are unable to accomplish and execute all those things. So this is a major sign that you are feeling low, feeling sad. So this is a major sign that you just get an appointment booked, because these conditions just get severe with time, and then if you will seek treatment, it will definitely take longer to get them treated. And if you will take the treatment any sooner for any of these 5 signs and symptoms, then your condition is more hopeful than the later stages. The fourth important point is the anger outbursts, lashing out quite easily, and that lashing out is actually affecting your life, everyday life, work, family, interactions, relationships, partnership, everything, any area of life is getting disturbed by that over expression of the anger, because anger is just as a natural feeling and natural emotion like happiness, sadness, any natural emotion. But anger gets so problematic when it is recurrent, when it is too much frequent, when it is not occasional. Then it is a sign that you need to get it checked, because it is a volcano which is erupting every day or every week, and it is disturbing your life patterns, your relationship, your surrounding. So this is a very important sign that you just get it looked and screened by a mental health professional. Let's talk about the last 5th sign, and that is the sleep issues, the sleep problems. And these sleep problems are not only that the person is unable to sleep well, and it is accompanying all of the sleep issues like change of the routine from your normal and usual pattern without any external or environmental requirement. For example, if we say that if your job is not requiring you to stay up late and you are staying up late because of the pattern of overthinking, maybe over worrying yourself about something, maybe all out of other conditions, maybe the signs and symptoms, the images, the memories are haunting you from the past, which are making it difficult for you to sleep on your time and follow your schedule, or maybe your daily activities are not that much exhausting that you just can't sleep at night, and they are not that exhausting because you stay in your bed already, because you are not feeling so good, so happy about, you are feeling sad, down, depressed, and that could be leading towards sleep issues as well. And sometimes it is not only down, depressed that you are going to experience a sleep issue. Sometimes the overthinking, and sometimes racing thoughts, sometimes the urgency, sometimes the brain working so fast is also unable to sleep. When the mood is so high, when we are feeling so euphoric, when we are feeling so happy, excited, curious, so you can relate that whenever you are too much excited, too much curious, and you are waiting for something good to happen next day, it is very difficult for you to sleep that day. But these are the occasional situations. But if this sleep pattern is consistent, that your sleep is disrupted, either you are not having a comfortable sleep, or even if you are having your 6 to 8 hours of sleep pattern, but still when you wake up you are having the disturbed sort of state, you are not that much refreshed, you are not that much comfortable after that sound sleep, then it is also showing the sign. And along with that, the last thing in the sleep pattern is the disturbing dreams as well. So if any of these things are happening with you, just book a consultation with your psychologist or mental health professional as early as possible. If you want to know more about these psychological knowledge, then keep subscribing this channel, and you can leave in the comment section whatever else you want to talk about. Thank you so much.